All right. Welcome to Psychiatric Nursing Part 2 review. Now, the first question that we have here is all about an acute episode of severe anxiety. The nurse should plan to take which of the appropriate action if the patient is experiencing acute episode of severe anxiety. All right, you need to stay and observe the client. You need to maintain an environment with low stimuli, and that's it. The other choices has nothing to do with severe anxiety, like discussing previous coping skills, plan to ambulate with the client in the hallway, instructing the client to identify what triggered the event, assesses the client for possible hypoventilation, and obtaining prescription for haloperidol. Okay. Now again, generalized anxiety disorder includes excessive worry, fatigue, irritability, muscle aches, restlessness, impaired concentration, and difficulty sleeping. Anti-anxiety drugs, we have benzodiazepines, we have short-acting, intermediate, and long-acting. Short-acting, example, midazolam. Intermediate, we have alprazolam, clonazepam, lorazepam. And long-acting, we have diazepam. Pum 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 pum. Alright, the next one that we will talk about is schizophrenia. Schizophrenia signs and symptoms, we have either negative or positive. For negative, there will be a decrease in emotional range, flat affect. There will be negative or decreased interest or drive in life. There will be decreased energy or inertia and decreased initiative. For positive schizophrenia, positive result would mean hallucination, delusion, disorganized speech, and bizarre behavior. Those are the positive schizophrenia signs and symptoms. Alright, the next one that we will talk about is PTSD, post-traumatic stress disorder. Which assessment finding would be expected? The answer would be hypervigilance. PTSD is characterized by an individual who has experienced or witnessed a traumatic event such as sexual assault, combat, violence, or medical illnesses. The client then experiences significant cognitive, affective, and behavioral response to stimuli, reminding them of the trauma they experienced. These chronic psychiatric condition causes a client to experience manifestations such as night terrors, avoidance of anything that may trigger trauma or memories, being easily startled, decreased concentration, hypervigilant, and sleep disturbances. This may cause the client to feel always on the edge. Like dissociative symptoms may occur with PTSD, such as derealization and depersonalization. Alright, now we will talk about delirium tremens. Delirium tremens. The nurse is caring for a client in the emergency department experiencing delirium tremens. The nurse should take which of the initial action? The initial action for a patient having some delirium tremens would be to implement seizure precaution. Delirium tremens is a medical emergency that may result in seizure activity. The nurse should always put the client's safety first at the forefront and provide seizure precautions. This includes patting the side rails, ensuring that IV access has been established, O2 is at the bedside, and suction is available. For seizure precaution, we have maintained patent airway, ensure IV access, and promote client safety. Like bed should be in the lowest position, pillow under the head, padded side rails. Next item would be reminiscence therapy. Reminiscence therapy. Reminiscence therapy is a therapeutic measure that enables an individual to recall past memories. Many older adults enjoy sharing past experiences through storytelling. As a therapy, reminiscence uses the recollection of the past to bring meaning and understanding to the present or resolve current conflicts. This approach also supports an individual's self-esteem by reflecting on positive events. So during reminiscence therapy, the patient will interact, or this approach helps support self-esteem. This is also an effective intervention for a group setting, and reminiscing is a way to express personal identity. This does not focus on looking forward. Reminiscing does not focus on future goals. It's like reminiscing the past. Reminiscence therapy. Next, we have opioid withdrawal. The nurse is assessing a client with opioid withdrawal. Which of the following would be unexpected findings? The answers are diaphoresis, irritability, rhinorrhea, and abdominal cramps. Opioid withdrawal is typically not life-threatening but highly uncomfortable for the client. Treatment is symptomatic, including encouraging hydration. If the client is experiencing vomiting or diarrhea, the nurse should advocate for treatment options to promote abstinence from opioids, such as pharmacotherapy by the use of methadone and naltrexone, and or psychotherapy. Again, a client experiencing opioid withdrawal will experience symptoms such as abdominal cramping, diarrhea, nausea, rhinorrhea, piloerection, diaphoresis, tachycardia, hypertension, insomnia, and agitation. So, patient with opioid toxicity will definitely not experience bradycardia or hypotension. Alright, next question is about psychosis. The nurse is caring for a client who is experiencing psychosis. The client states, "You all are trying to kill me." Which of the following response would be most appropriate for the nurse to make to the client? The answer is, "What makes you think we are trying to kill you?" When caring for a client experiencing psychosis, the nurse should avoid physical contact with the client, maintain a safe environment, and reorient the patient to reality without being argumentative. A client experiencing psychosis does not exhibit a rational thought process and may have impaired reality testing. If the client is paranoid, the nurse should attempt to understand the paranoia as the patient has likely misconstrued an action. Your next question is about denial, a defense mechanism. The nurse is assessing a client suspected of having the early stage of dementia. The defense mechanism that the nurse would expect would be denial. In the early stage of dementia, it is quite common for family members and the client to exhibit denial. Denial is utilized to avert the unpleasant emotions surrounding the diagnosis of dementia, which is progressive in terms of its symptom intensity. Typically, symptoms that may be concerning for dementia are noticed by family or friends. This individual, an informant, usually brings this concern forward to the primary health care provider. Alright, next one, the nurse is educating community members on the signs and symptoms of substance abuse and intoxication. Which information should the nurse include? The nurse should include inhalants may cause slurred speech, loss of motor coordination, and nausea. Number 2, alcohol may cause drowsiness, slurred speech, and difficulty with walking. And number 3, Marijuana may cause a slowed reaction time and problems with balance and memory. Depending on the inhalant, an individual may experience loss of inhibition, headache, nausea, poor muscle coordination, and slurred speech. Alcohol may cause drowsiness, loss of inhibition, and difficulty walking. Marijuana may cause a slowed reaction time, difficulty with learning and memory, and hallucination. Crisis helplines are highly important due to which of the following? It often saves lives when a person is in severe crisis. Crisis helplines are highly relevant because these helplines often save lives when a person is in a severe crisis. These helplines are staffed with people who use somewhat scripted verbal communication that addresses the here and now of the crisis. The caller can remain anonymous if they choose to do so. They are always allowed to solve their immediate problem and be able to cope with their stressors in the crisis. Client is admitted due to anorexia nervosa. The assessment parameter that the nurse should prioritize is the client's electrolyte levels. Clients with anorexia nervosa often experience electrolyte abnormalities, specifically hypokalemia and/or hyponatremia. These electrolyte abnormalities may predispose the client to tachyarrhythmias or sudden death due to ventricular tachyarrhythmias. The next question is also about anorexia nervosa. At an eating disorder treatment center, a nurse is caring for a client with anorexia nervosa who has recently arrived at the facility. Which intervention should the nurse apply following the client's meal? The nurse needs to restrict the client from using the restroom for 90 minutes after each meal. The nurse is caring for a client with narcolepsy. The following medication would the nurse anticipate is modafinil. Modafinil is a psychostimulant that is effective in treating narcolepsy. This medication promotes wakefulness and is dosed either once or twice a day. Narcolepsy is a syndrome in which a client has significant daytime sleepiness that often lessens after a nap. Stimulants such as modafinil are indicated in the management of narcolepsy as they promote wakefulness. The psychiatric nurse is providing a care for a patient who has just calmed down after exhibiting inappropriate behavior related to bipolar disorder. The nurse knows that which of the following is the best way to help prevent another and similar episode. Assist the client in understanding the triggering events or feelings that may have led to the outburst. The psychiatric nurse would be most effective in preventing further inappropriate episode by assisting the client in understanding that may have triggered the event. Next one, the nurse is caring for a client with a history of aggressive, violent behavior. When caring for this client, the nurse should initially take which action? You need to establish trust with the client. The first thing that the nurse should do to prevent violence is to establish trust with the client. Next one is about milieu therapy. Information about milieu therapy is an emphasis of this therapy is the setting, the structure, and the emotional climate as important to the client's healing. The cornerstone of milieu therapy is to provide an all-inclusive staff and client structured environment that fosters routine, safety, and acceptance. This environment enables healing and promotes positive outcomes. Our next one is anorexia nervosa. Signs and symptoms includes lanugo and hypothermia. Lanugo describes as fine, soft hair that covers the body and limbs of a human or fetus or newborn. It is abnormal for an adult, which is said in this example, which is a 16-year-old adult to have lanugo. In a client who is severely underweight and has lost a large amount of subcutaneous fat, the body may develop lanugo as a form of insulation. Subcutaneous fat is necessary to insulate the body and regulate the temperature, so patient will also have hypothermia. Anorexia nervosa signs and symptoms: we have distorted body image and low self-esteem, restrict or avoid food and deny hunger, extreme fear of gaining weight, excessive or compulsive exercise, frequent dieting and obsession with calories, not maintaining a healthy weight, and rituals around eating. Alright, next one. The nurse is developing safety plan for a client experiencing domestic violence. The nurse should recommend which elements are included in the plan. Number 1, safe family, friends, and places to stay. Number 2, phone numbers to call for assistance. Number 3, a bag in a safe place containing clothes and important documents. And number 4, money or a credit card that cannot be traced. Alright, next one. The nurse is performing an assessment on a client. The client tells the nurse, "You people are part of the government plotting to destroy me." The nurse should respond with which appropriate statement? The nurse should say, "Tell me more about someone trying to destroy you." Alright, next one is about naloxone. Naloxone is the antidote for morphine. If the patient is overdosed with morphine, the nurse could get a prescription for naloxone or naloxone. Next question. A client was brought to a local emergency department after police officers located the client walking in the neighborhood at night without shoes in the snow. The client appears confused and disoriented. The first action or the priority action of the nurse at this point is to assess and stabilize the client medically. Before addressing any existing psychiatric issues which may be present, the client must be fully assessed medically. If one or more medical issues are identified, those issues must be addressed and stabilized. Alright, next one. A client is scheduled for a hip replacement surgery. The client expresses anxiety to the nurse regarding the upcoming surgery. The response by the nurse, which is most therapeutic, would be, "Can you tell me what you have been told about the surgery?" Next question. Which of the following types of grief are not considered normal and require some interventions from the members of the healthcare team? Number 1, a complicated grief, and the other one is unresolved grief. Complicated grief and unresolved grief are not considered normal. Both types, therefore, require some interventions from the healthcare team members. Complicated grief is defined as the pathological grief. It is characterized by maladaptive coping methods with the loss and the loss of normal functioning 6 months after the event. Unresolved grief is characterized by an exaggerated and prolonged period of mourning. This question: a patient presents to the emergency department with pinpoint pupils, poor attention, and slurred speech. Upon assessment of vitals, the patient is found to have a blood pressure of 90 to 60, heart rate of 58, respiration of 14, and temperature of 96.8. Which substance is the patient intoxication most likely related to? The answer is opiates. The patient is showing signs of opiate intoxication. Opiate intoxication is characterized by pinpoint pupils, slurred speech, inattention, lethargy, psychomotor retardation, and impaired memory, judgment, and social function. Changes to vital signs includes hypotension, decreased heart rate, and reduced temperature and lower respiratory rate. On the other hand, alcohol intoxication is characterized by unsteady gait or balance, nystagmus, flushed face, sedation, impaired judgment, uninhibited behavior, talkativeness, slurred speech, impaired memory, and irritability. While cannabis intoxication is characterized by reddened eyes, increased heart rate, dry mouth, hunger, loss of coordination or balance, relaxed mood, increased perceptions, social withdrawal, and paranoia. And cocaine intoxication is characterized by pupil dilation, increased or decreased heart rate and blood pressure, chills, nausea and vomiting, sweating, pacing, psychomotor agitation, visual or tactile hallucinations, and hypervigilance. Our next question, the nurse works in a long-term psychiatric rehab center and is assigned to a patient with debilitating agoraphobia. The patient is going through desensitization therapy. Which of the following interventions is an appropriate part of this treatment? Number 1, take a short walk in the hallway outside of his room. Number 2, build rapport with the client. And the third one is teach anxiety management techniques. Our next question, the nurse is caring for a client who is demonstrating signs of aggression. The nurse should plan to take which action? Number 1, use genuineness and empathy. Number 2, use a calm, clear tone of voice. Number 3, give several clear options. And number 4, respond as early as possible. The nurse should not use therapeutic touch when dealing with an aggressive client. This would be misconstrued as aggression on the nurse's part. The nurse should confer with the client in an area with minimal stimulation, but not in a closed, private room. This space may allow the client to physically assault the nurse without others noticing. Clinic tells the nurse, I want to kill my wife. The moment I see her, I am going to kill her. Which of the following should be the nurse's next action? The answer is to notify the client's psychiatrist of the comments. Confidentiality plays a critical role in a client care. However, there may be certain circumstances where confidentiality must be breached to not only ensure the safety of the client but also to protect the third party. This concept is referred to as the duty to warn or duty to protect. These types of situations most often arise when a client reports suicidal ideation, homicidal ideation, or when the client makes a threat against an identifiable third party, even if the threat was made during a private therapy session. Alright, next one, which of the following statement indicates body image distortion in a patient with anorexia nervosa? It is when the patient will say, I am so overweight. Patient with anorexia perceives themselves to look very different than they do. Many of these patients see someone in the mirror who weighs more than their desired weight. Despite being too thin, this client will not eat in hopes of getting the perfect body. Next question, the nurse is working with a client who suffers from obsessive compulsive disorder. The client has an obsession with the dangers of germs and performs compulsive hand washing hundreds of times per day. Which of the following should the nurse include in this client's treatment plan? The answer would be number 1, create a schedule for your hand washing ritual. Number 2, incorporate meditation into their daily schedule. Number 3, administer fluoxetine as ordered. Okay, the drug selective serotonin reuptake inhibitor or fluoxetine medication are commonly used to help clients manage compulsive disorders or behaviors. Examples are fluoxetine, fluvoxamine, and sertraline. Alright, the incorrect choices on this question is when you teach the client about the dangers of overhand washing. This is not practical and not therapeutic. The other incorrect option would be preventing the client from performing the compulsive ritual. This isn't therapeutic or acceptable either. Alright, we'll talk about divorce or parental separation. This is a traumatic event for all ages, including adolescents. It is highly recommended that telling children and adolescents about divorce be planned and best delivered by both partners simultaneously. This is an ideal setup because it establishes a unified front of support at a time when the child or adolescent may feel lost. The parents should not avoid the discussion of divorce because it is unsettling for the child to have a sense of confusion or ambiguity regarding the parental arrangement. Addressing the divorce with the children clearly and empathetically best. Providing physical and emotional reassurance, such as holding the child's hand, offers comfort. It is expected that children may react negatively with a sense of resentment. This resentment can be ameliorated by keeping the channels of communication open and conveying both physical and emotional support. For the first question that we have here, the nurse is caring for a patient with atrial fibrillation who is taking warfarin. Which alternative therapy should the nurse advise the patient to avoid? The patient needs to avoid the 3 Gs and saw palmetto based on the options. We have ginger root, garlic, ginkgo biloba, and saw palmetto. Those alternatives will increase the risk of bleeding to this patient who is taking warfarin. All right, next one, we have a patient who is on a chest tube for a pneumothorax. The nurse assesses crackling sounds. Mayroong crackling sensation beneath the fingertips around the chest tube insertion site. The nurse should take which of the following action? The answer would be to notify the primary healthcare provider or PHCP. Notifying PHCP is essential because this assessment indicates crepitus, which is air trapped in and under the skin, known as subcutaneous emphysema. Okay, next one is about pedia or child health, growth, and development. Ito medyo tricky to. Sabi ng question, the nurse is preparing to review teaching handout about developmental milestone with parents who have a 6-month-old child. 6-month-old child. The child was born at 28 weeks of gestation. Again, 6-month-old child. The child was born at 28 weeks gestation. Which of the following handout are more or most appropriate when discussing the child's development? Sabi dito is developmental milestone for a 3 months. Our developmental milestone for a 3-month-old will be appropriate for this patient. Although the baby is 6 months old, it was born 28 weeks gestation. Premature infants should always be evaluated based on their corrected gestational age. A full-term pregnancy lasts 39 weeks through 40 weeks and 6 days. In this case, birth is 28 weeks or is 12 weeks or 3 months early. So the nurse must subtract the 3 months from the appropriate developmental age, which is 6. So 6 minus 3 equals 3. 3 months old is the appropriate developmental milestone to review with the parents. For growth and developmental milestone for a 3 months old, 3-letter word, coo, C-O-O. Coo. The 3 months baby is able to make cooing sounds, smile at people, emit distinct cries for different needs, recognizes familiar voices, expresses different pleasure versus displeasure of sounds. It's either giggles or cry. All right, next question. A neonate is suspected of having a tracheoesophageal fistula. Which symptom would the nurse observe from the neonate? The nurse should expect patient to be cyanotic. Cyanosis is a notable symptom in neonate with tracheoesophageal fistula. The cyanosis often results from laryngospasm, a protective mechanism that the body has to prevent aspiration into the trachea. Tracheoesophageal fistula is an abnormal passage or connection between the esophagus, typically the lower esophagus, and the trachea. Cyanotic spells, also known as blue spells, dying spells, or apparent life-threatening events, refer to a bluish tone visible in the mucosal membranes and skin caused by an oxygen decrease in the peripheral circulation. Esophageal atresia and tracheoesophageal fistula often occur together. Our next question, the nurse is caring for a client with hypernatremia. The prescribed IV fluid would be dextrose 5% and water. This client has hypernatremia, sodium above 145 MEq per liter, and should avoid additional sodium-containing fluids. Dextrose 5% in water is used to replace water losses due to hypernatremia. It would be an appropriate maintenance fluid for this client because it contains free water with no added sodium or other electrolytes and promotes renal solute excretion. We have hypernatremia management. We have the initials FLAG, F-L-A-G, F for free water administration, loop diuretics, agent causing, remove agent cause, and give fluids or IV fluids. Next one, the nurse performs a physical assessment on a client and observes the client to have palmar flexion. While obtaining the blood pressure, the nurse should take which action? The nurse should request an order for magnesium level. Palmar. Magnesium level. Palmar flexion while obtaining blood pressure demonstrate the Trousseau sign. This sign is associated with severely low levels of magnesium or calcium. It would be appropriate for the nurse to obtain a magnesium level to discern if this level is low, which, if it is, may be replaced as prescribed. Palmar flexion, give magnesium level. Next question, the nurse is assisting a client with their insulin pump. The nurse understands which insulin is commonly loaded into the pump. The answer is rapid acting. A rapid-acting insulin is the most common insulin used in insulin pump. A rapid-acting insulin is correctional insulin and should be appropriately dosed 10 to 15 minutes before a client's meal or while actively eating. Short-acting regular insulin may be alternatively loaded into the insulin pump. Alright, next one, the most serious adverse effect of tricyclic antidepressant or TCA overdose is cardiac arrhythmias. The excessive ingestion of tricyclic antidepressant or TCAs results in life-threatening wide QRS complex tachycardia. Tricyclic antidepressants are approved by the Food and Drug Administration for treating several types of depression, obsessive-compulsive disorders, and bedwetting. Right, we will talk about meter dose inhaler without a spacer. The patient should tilt the head back slightly. Have the patient open his or her mouth. Position the inhaler 1 to 2 inches away from the client's mouth. Some clients may measure their distance as 1 to 2 finger sweeps for self-administration. This is considered the best way to use the MDI or meter dose inhaler without a spacer. Alternatively, the client may place the inhaler mouthpiece in the mouth with the opening towards the back of the throat. Have the client exhale completely and then press down once on the inhaler to release the medication. Have the client breathe in slowly and deeply for 5 seconds. Have the client hold his or her breath for approximately 10 seconds and then exhale slowly through the nose or pursed lip. So if the patient will tell you that after I deliver a dose, I will hold my breath for 10 seconds, I will only inhale 1 spray with 1 breath, and while holding my mouthpiece away from my mouth, I will take a deep breath and exhale completely, it means that the patient understands on how to use an MDI or meter dose inhaler. Now we will talk about stage of sleep cycle. Ano yung sequence ng sleep cycle? Number 1, the stage of sleep cycle that is characterized with a brief period of a very light sleep. Number 2, the stage of sleep cycle that is characterized with 10 to 20 minutes duration. Number 3, the stage of sleep cycle that is characterized by delta waves. Number 4, the stage of the sleep cycle that is characterized with vivid dreams. We will talk about trichomonas vaginalis. The nurse plans to take which appropriate action? The nurse should obtain a prescription for metronidazole. Trichomoniasis is a protozoan infection primarily spread through sexual contact. The treatment for this infection is metronidazole because of its antibiotic and antiprotozoal properties. This effective treatment may be prescribed in a single dose or for over several days. Next one, we will talk about non-rebreather mask. Non-rebreather mask is for patients who is having carbon monoxide poisoning, and when we administer oxygen to this patient, it should be via non-rebreather mask. Carbon monoxide poisoning requires aggressive oxygenation at FiO2 at 100%. A non-rebreather is the only delivery device to provide FiO2 level of 100% and is used for a client with CO poisoning or carbon monoxide poisoning. Side notes, carbon monoxide poisoning requires 100 oxygen. Will not get help from nasal cannula, Venturi mask, and simple mask. Nasal mask, it only delivers 1 to 6 liters. Venturi mask will only deliver 4 to 10. And simple mask will only deliver 5 to 8. Okay, nasal cannula 1 to 6. Venturi 4 to 10. And simple mask is 5 to 8. Cannula is 1 to 6. Venturi 4 to 10. Simple face mask 5 to 8. Now we will talk about autonomic dysreflexia in a client who is experiencing spinal cord injury. The most common causes of autonomic dysreflexia are bladder or bowel distension, urinary tract infection, pressure ulcers, or other noxious stimuli below the level of the spinal cord injury. Treatment for autonomic dysreflexia involves identifying and removing the noxious stimulus, which may require urgent medical attention. Medication to lower blood pressure may also be given if necessary. Individuals with SCI who are at risk for autonomic dysreflexia should be educated about the condition and its symptoms and instructed on how to prevent and manage it. So kapag meron siyang autonomic dysreflexia who is experiencing spinal cord injury, the nurse understands that the symptoms includes the following, like sudden headache, flushed face, nasal congestion, profuse sweating above the level of the injury. Alright, next one we will talk about sinus tachycardia. Sinus tachycardia is regular with P wave present. The rate of sinus tachycardia is over 100 beats per minute. Treatment for sinus tachycardia is the underlying cause. If the client is hypovolemic, fluids need to be replaced. ST may be worrisome as it is one of the earliest manifestation of shock. So the tracing reflects sinus tachycardia. Can be caused by an array of conditions such as dehydration, hyperglycemia, stress, anxiety, thyroid conditions such as hyperthyroidism, or Graves' disease. Graves' disease is the most common cause of hyperthyroidism, and this increased metabolic and sympathetic activity would cause tachycardia. Next, we will talk about scleroderma. The nurse is caring for a patient with a medical diagnosis of scleroderma who reports fingertips tingling and turning white in response to cold or stress. The nurse would recognize these symptoms as which problem? It's called Raynaud's phenomenon. The patient's symptoms are consistent with Raynaud's phenomenon. This condition is characterized by sudden or intermittent vasospasms in the fingertips and toes in response to cold temperature of stress, resulting in decreased blood flow and blanching of the skin in these areas. This phase is typically followed by a blue phase when hemoglobin releases oxygen into these tissues, and red phase when the areas are rewarmed. Sensations of tingling and numbness are common during these episodes. Or the next thing that we will talk about is hearing loss. Hearing loss is divided into sensory neural or conductive. Conductive hearing loss is caused by obstruction. Causes of this type of hearing loss include cerumen, foreign body, water, edema, infection, or tumor. This type of hearing loss may be reversible. Yung sensory neural hearing loss naman, causes of this type of loss, again, which is the sensory neural hearing loss, includes prolonged exposure to noise, autotoxic substances like aminoglycosides, diabetes mellitus, presbygosis, which is age-related hearing loss. This type of hearing loss is often not reversible. Right, we will talk about social support. There are 4 types of social support. We have the emotional social support, instrumental social support, informational social support, and appraisal social support. Emotional social support includes expression of empathy, love, trust, and caring to the client. Those are emotional support. Instrumental social support system provide the client with tangible aid and or services. Information social support system provides the client with advice, suggestions, and or information. And appraisal social support system provide information useful for self-evaluation by the client. We have a sample question. Your client has just undergone a fecal diversion surgery and will be discharged to their home. Which type of social support person or support network is most likely to benefit this client in terms of post-discharge self-care and physical adaptation necessary for this client? The answer is a peer support network like Ostomy Group and the community to provide self-care. Alright, now we will talk about adult CPR. The new nurse understands that the high-quality cardiopulmonary resuscitation or CPR for an adult consists of which of the following? The answers are a compression rate of 100 to 120 per minute. Allow full chest recoil between compression. Rotate compressor at least every 2 minutes. Again, compression rate is 100 to 120 per minute. Allow full chest recoil between compression and rotate compressor at least every 2 minutes. The purpose of CPR is to move blood through the heart and to the body cells to prevent death. According to the American Heart Association, high-quality CPR includes compression rate of 100 to 120 per minute to a depth of 2 to 2.4 inches. The provider must allow full chest recoil between each compressor. Full chest recoil allows the heart chambers to fill with blood between compressions. When the ventricles fill, more oxygenated blood will be available to the cells. Fatigue will result in less effective compression. So, AHA recommends that the compressor rotate every 2 minutes or 5 cycles of compression to prevent fatigue. Sa pediatric naman, guidelines for CPR. 1 rescuer, cycle of 30 compression for 2 hours or 2 breaths. Again, kapag isa lang yung rescuer, cycles of 30 compression to 2 breaths. Kapag dalawa naman yung rescuer, cycles of 15 compression to 2 breaths. Compression breath naman kapag pediatric is 1.5 inch. And for infants is 2 inches for children. Ang compression depth kapag pediatric is 1.5 for infants and kapag children naman is 2 inches. Now we will talk about liver biopsy. A nurse is in charge of a client scheduled for a liver biopsy at 8 a.m. In preparation for the procedure, the nurse should do which of the following? Inform the client that their vital signs will be closely monitored after the procedure. Client's vital signs will be monitored before, during, and after the procedure of liver biopsy. One of the primary reasons for monitoring the vital signs post-procedure is to monitor the clients for signs and symptoms of bleeding and or shock following the procedure. Yung functions nga pala ng liver, again, notes. The liver produces bile, albumin, and cholesterol, converts glucose, glycogen for storage, converts ammonia to urea, metabolizes bilirubin in the breakdown of RBCs, metabolizes drugs and toxins, produces clotting factors, and regulates blood clotting. Next question. The nurse is preparing to infuse prescribed cisplatin to a client with cancer. The priority assessment should the nurse make before administration is IV patency. IV patency. IV patency is critical to assess before the infusion of a chemotherapeutic drug. Serious injuries, extravasation have been caused by medications like cisplatin being infused into a non-patent vascular access device. Central lines are highly recommended when infusing chemotherapeutic drugs like cisplatin.